Good afternoon, Governor.
Good afternoon.
And to everyone at home, including Michael Bilo of Motif Magazine, whose question landed first in the queue today. He asked if someone comes into Rhode Island for a day or two, not intending to remain, to work on their house or boat and not interacting with anyone else, is this work-related or otherwise exempt from the 14-day quarantine rule?
Yeah, so thank you. I'm not sure I fully understand the question because that would suggest they live someplace else, and my authority, of course, is only over people in Rhode Island. But here's what I would say. The order I have in place is a stay-at-home order. Everybody needs to be doing everything they can to stay at home. That means avoiding any out-of-home activities that are not absolutely essential. So some of us, many of us, have to go to work. If you have to go to work, go to work. Abide by social distancing, wash your hands constantly, wear your mask, go home. If you have to work in Massachusetts or Connecticut, same thing. Drive across state lines, come home, and stay in your house. For those, the quarantine, as it relates to out of people coming here, is if someone comes from any other state, by any means, car, bus, train, plane, and they come into Rhode Island with an intention to stay here for a non-work reason, they must remain in quarantine for 14 days while they are in Rhode Island. So hopefully that clarifies. There will doubtless be, I find that people are saying, what about this precise example? What about that precise example? Look, here's the deal. We want you to be in your house. We want you to stay away from people. And we want you to limit your activity to as few number of people as possible, period. So don't look for ways to push the limits. Stop asking, in all of us, stop asking, how can I push it? How can I do this? The answer is don't do it. Stop. We got to do this until May 8th, because then hopefully after May 8th we can get, think about at some point returning to life in a new normal.
Steve Alquist of Uprise, Rhode Island, reports there was a pandemic-safe protest outside the Wyatt yesterday. You said the Wyatt is outside your legal authority, but would you lend your moral authority to the cause and support California-style legislation banning private prisons and ICE contracts in Rhode Island?
Yeah, so I have already said that I would support legislation banning private prisons in Rhode Island. As it relates to Wyatt, it is a federally run prison over which I have no authority. Having said that, I care about everybody who's in my state, and I have been in touch, my staff has been in touch with Wyatt, with the federal marshal. I've been in touch with the federal courts and urge them all in the strongest possible terms to do everything they can to protect public health and human rights.
Our next question is from Ryan Belmore of What's Up Newport. Governor, when do you plan to provide further guidance or announcements regarding your orders that have closed schools, restaurants, and businesses?
Yeah, so right now all of those restrictions are in place until May 8th. And the honest answer is whether I have to extend those beyond May 8th depends totally on how well we comply with the restrictions between now and May 8th. So the best thing I can tell you is right now, until May 8th, clamp down. Don't push it. Follow the rules as strictly as is humanly possible. And that gives us all the best chance for me to start easing restrictions as soon as possible.
Tara Granahan of WPRO Radio asks, Dr. Mockdad, the physician behind the coronavirus pandemic model at the University of Washington, said yesterday that, quote, the worst is behind us as a country, end quote. Where is Rhode Island's model?
Where is Rhode Island's model? I mean, we have a model. Is the worst behind us in Rhode Island? No, I don't think so. I think the surge is ahead of us, not behind us. But again, it all depends on how well we do. If everybody this weekend, it's a nice day, starts to go and crowd into the garden centers of shops and go home and plant in their community garden or spend Easter tomorrow in big crowds, the worst is definitely ahead of us. So it's up to us as individuals to do the right thing right now in order to minimize the pain and minimize the slope of the curve and kind of flatten out the line, as we've been saying.
Eli Sherman asks another question. Based on state modeling, when do you expect the state will need to start using the 3 new hospitals?
Our goal is to have at least one of the hospitals up and running in a couple of weeks. And I don't foresee, and I think that will happen. I think the Convention Center Hospital should be able to take patients in a couple of weeks, and I don't foresee a scenario where we need it any sooner. Because again, as I said, the first step is increasing capacity in the existing hospitals. So right now there's bed availability of our existing hospitals under normal circumstances. Then each hospital has surge plans in place to extend their capacity in their hospital. And then it's only after that that we would go to the additional hospitals. So I think we're several weeks away, and I'm confident we'll be ready by the time that time comes.
Daniel Kittredge of the Cranston Herald is asking the following. Can you tell us a bit more about the contact tracing process, how quickly it currently occurs after a positive diagnosis, and how determinations are made regarding which potential contacts may have been infected?
So I'll start with the second part of that question. There's a very in-depth process that occurs with the initial part of contact tracing, which is case investigation. We have a conversation with the person who is a positive case and do a full landscape assessment of all of the people that they have been in contact with from a time frame before their onset of illness until when we are in communication with them. Some descriptions of a direct contact who is at highest risk of transmission includes people who have been in close direct contact, less than 6 feet of distance, for more than 10 minutes at a time. And so that oftentimes automatically becomes household contacts, but then you also look at who someone is exposed to at work if they have been going to work, which is why we are strongly promoting working remotely anytime that you can. And then it also involves other scenarios where you may have come in contact with someone. That's why we cannot underscore enough the importance of keeping track of who you have been in contact with. In terms of how soon we are able to reach someone, we are collecting information from a variety of laboratory sources regarding positive cases. And we have had a significant increase in the number of cases. So we're balancing having an expanded team to be able to respond and to be able to collect the laboratory information so that we can reach the people who are needing to be contacted. That time frame can be as soon as within the hour of us finding out to within a few hours, knowing, such as yesterday, the 334 new cases that we received. So we're looking to expand to be able to continue the rapid turnaround time that we need in place to be able to do that.
Next question is from Joe Tasca at the Public's Radio. What is the state doing to address safety concerns at Electric Boat and other essential businesses?
Thank you for the question. We've been in extremely close contact with Electric Boat. Myself personally and Commerce Secretary Pryor is in very close contact with them. We're also in contact with dozens of manufacturers and the Rhode Island Manufacturers Association, all to continue to check in on them to make sure that they're obeying the social distancing rules, taking temperatures of employees, making sure nobody goes to work sick, making sure people have the opportunity to work 6 feet apart. Most manufacturers who've remained open have completely redone their floor plan so that employees can work safely. So we are on it to the extent we can be, in constant contact. And I would say if anyone out there works at a manufacturing operation or knows of a manufacturing operation where you feel that these conditions aren't being met or employees are not given the opportunity to work in a safe environment, I want you to let us know. Go online to the Department of Business Regulation, DBR, or call them or sent an email to the governor's office, let us know so we can address the situation. I made a decision to allow manufacturers to stay open. Many states have not done that. I thought it was important because I need to maintain a semblance of an economy and keep as many people working as is safely possible. That decision depends upon manufacturers to make the adjustments necessary so that their employees can stay safe. And I will say, manufacturers on the whole have been fantastic and great collaborators. So thank you to the manufacturers and the Manufacturers Association. And if you know of a situation where you think it's not going well, then let us know so we can take care of it.
Amanda Milkovits of the Boston Globe is asking, how many healthcare workers do you need and what do you have?
Thank you for that. These numbers are fluid, so I hesitate to say specifically a number, but can certainly get back to you in providing that. It's helpful for people to understand that as the modeling is being done and we are projecting out, preparing for the hospital sites that the governor shared, we need to have enough staff to be able to provide the care in those hospital sites. And we know that what we have now requires more. Those are numbers and directions that I can share, and certainly will reiterate the call out to anyone who has any type of clinical background to please join us and go to Rhode Island Responds so that we can compile that information and have a more accurate assessment to the fluid numbers of where we are now and what we will still need.
The next question is also for you from Kate Nagel of Go Local Prov. Is Rhode Island allowing hydroxychloroquine to be prescribed as a treatment to COVID-19?
We are working closely with infectious disease experts throughout the state who are really the ones that have the most familiarity with prescribing hydroxychloroquine. So it is not banned from being used, but we want to make sure that hydroxychloroquine is only used for COVID-19 in the specific indicated situations it is used for. That's hospitalized settings with infectious disease and other clinical experts who are most familiar with being able to use it. We do not want hydroxychloroquine just used in the community or with providers for people who do not require it, because there is then a concern for people who actually are using hydroxychloroquine for an FDA-approved indicated reason, running the risk of not having access to that life-saving medication that they need it for. So we need to make sure that we are clear that hydroxychloroquine is only being used in those specific situations with the specific indicated clinicians who have been authorized to prescribe it.
I'll read the next question by Nancy Thomas of Rhode Island News Today in two parts. Rhode Island is listed on National News Today as being a new hotspot with a 189% increase in cases. Does this not only reflect the increase in number of people tested, correct?
In essence, we know that we are testing more people, and that has been our deliberate approach, and because of that, we knew we would be identifying more cases. We want to get a full landscape of the state, and we actually have the population that allows us to do that, to understand who is out there based on testing or based on symptoms so that we can identify them, get them into their proper isolation settings with the support that they need, and address all of the contacts that are around them who can also be quarantined, staying at home and monitoring themselves for symptoms. That is the most effective way for us to get a handle on this virus as a state.
Nancy continues to ask, how correct is any data being reported on at a national level?
Everyone nationally has this challenge of being able to capture as much as they can of their population in terms of testing, being able to collect the data to understand who is positive based on testing. That means being able to do what we are doing here, is developing a specific strategy for accessing our vulnerable populations, those who may not be able to drive, those who may be homebound, those who may not have the economic means to get somewhere where testing is available. We are putting together deliberate approaches to being able to address those folks so that we can understand the landscape of the entire state's population of people that need to be tested, and do it as well with symptoms. We want to make sure that we are rolling out the contact tracing program for anyone who is tested, and all that get tested should have symptoms, as well as anyone who may not have been able to be tested but still has symptoms. We still want to make sure that they are receiving the proper isolation, as well as their contacts being quarantined appropriately too.
Thank you, Doctor. We'll take this last question from Christian Winthrop of the Newport Buzz. Sure.
I want to offer two comments related to two of the questions that Nicole did a terrific job answering. With respect to how many healthcare professionals we'll need in the surge, I want to say two things. The answer to that question depends on how many people we have in the hospital at any one time, obviously. The way we are working with our healthcare providers to develop protocols that are best in class. Again, if you wind up in one of these quote-unquote field hospitals, you're going to get best in class treatment. So they have protocols. You need this many doctors per 40 patients, this many nurses per 40 patients, this many aides per 40 patients, et cetera. And so we're building our model and making sure, as I've said all along, we are working for the best, planning for the worst. And I want you to have confidence that even if we have 2,000, 3,000, 4,000 people in the hospital at any one time, we're going to have the doctors and nurses and healthcare professionals to take care of you. But in order for that to happen, that's why we keep saying, help us out if you can, if you're retired and not working full-time. But I want you to know that's the thinking behind it, and also why it's so important that people sign up. Then there was another thought, and it just flew out of my head. But anyway, people are getting nervous about this, and I think it's important that people know we have this plan. If we obey social distancing, we may never get to that point where we have thousands of people in the hospital at once, but I'd rather be prepared and not need it than need it and not be prepared.
The last question is from Christian Winthrop of the Newport Buzz. When do you foresee those who have contracted and recovered from COVID-19, including those who have not yet been tested, to be able to resume day-to-day activities?
I think Nicole answered that question earlier, so I'm not going to continue to go into that. I remembered what I wanted to say. As to the hot spots, this is an important thing for Rhode Islanders to realize. Although we're doing extremely well, we're testing among the most per capita in the country. You've got every Rhode Islander doing a great job, by and large, obeying social distancing. We have two things working against us. Number one, Rhode Island is the most densely populated state in the country. Density is not a good thing when you're dealing with the virus. It's harder to stay away from people when we're densely populated. The other thing is, relative to many other states, we have a high percentage of seniors in Rhode Island. So, again, are we a hotspot? Is the data accurate? The data is as accurate as it can be. It's difficult to do state-by-state comparisons. We're doing a lot more testing than other states. But you do need to know a couple of the things that make this fight harder for us is we have a high percentage of seniors who are the most vulnerable and have the highest risk of the worst outcome if they get the virus, and we're very densely populated, which is my way of saying, please obey the social distancing, because it's the only chance we've got to get through this as safely as possible. Good? Do you want to answer that again? Sure. It was important.
So I'll answer again the question of, after someone has COVID-19, what are the requirements that need to be in place in order to say that they have recovered and can resume their day-to-day activities, which should still be staying at home? The first is there should be at least 7 days of illness between the time the symptoms started and when that is. If someone gets better in a shorter time frame than that, then they need to wait until at least 7 days have passed. Most people are going beyond the 7 days. The second is, in addition to the 7 days, the final 3 days need to be days with no fever without taking any fever-reducing medication, Tylenol or Motrin. You cannot say you're without a fever for 3 days if you've been taking Tylenol or Motrin or something else to reduce fevers around the clock. So 3 full days of no fever without taking any fever-reducing medications, and your symptoms have to have completely resolved. It can't be that they're still, you're getting better, but not completely resolved. And so all of that usually takes more than 7 days. So 7 days is the minimum, 3 days with no fever, and having all symptoms have resolved. That then should mean that you can maybe come off of being isolated within your own home to minimize transmission of infection to other people. But it definitely also means that you should still continue to follow the stay-at-home order, still continue to work remotely, still only go out if you have essential needs, groceries, come right back home. The reason is there is still risk of additional infection. So we want to make sure we're still learning about that, but we want to make sure that people clearly understand it doesn't mean you can start disobeying any of the rules that are in place. Everyone needs to follow them. That is how we're going to get through this together. So with that, thank you very much.